around my table there was several volunteer groups represented, the Alzheimer's Society and the Stroke Association and my own group, Asthma UK, and we talked about the way that volunteer groups could help the NHS in a kind of formalised way, because at the moment we do a lot of work to try and raise awareness of asthma, but we have to do it in a kind of we have to try and prompt them to display leaflets in GP surgeries, etc. But if the NHS were to engage more with the volunteer groups, then that could lead to more patient awareness of the condition that they've just been diagnosed with, because there's a fearful period of time, first few months of any condition, and if we talked on our group about perhaps a buddy system, so somebody with a condition that was well established could talk to the person that had just recently been diagnosed and help them to understand, take away the fear, help them to understand how the medication that they've been given works. I mean, asthma sufferers often don't know how to use the medication because it's quite complicated. So things like that would be really helpful, and they're some of the things that we discussed around our table. We discussed a new role within the NHS, which was an NHS volunteer coordinator who could direct the whole approach. So the NHS could formalise a list of those groups that were willing to participate, and then that director could work out a strategy for how the volunteer groups got involved. And perhaps when a GP first diagnoses a condition and writes a prescription, there could be a prescription for the advice as well. So for instance, if an inhaler is prescribed, then the address for Asthma UK pops up on the prescription. So the new patient has got the prescription to take home and a name and address and an email address for the organisation that the GP thinks that they should get in contact with. That means that this 3 or 4 minute period in the GP surgery would be added to, because the patient could then go home, look at the website of Asthma UK or the Alzheimer's Society and just get all the information that they needed, and then the buddy situation that maybe could come later.